Federal funding cuts force San Diego to halt Section 8 housing waitlist. This report examines recent changes to housing assistance programs in San Diego, California, and the impact of federal funding limitations on local housing access. San Diego remains one of the most expensive housing markets in the United States. Over the past several years, rising rental costs have increasingly outpaced growth in household income and public housing assistance funding. Local housing officials now report that these pressures have reached a point where program capacity can no longer meet demand. As a result, the Section 8 housing voucher waitlist in San Diego has been formally closed. New applications are not currently being accepted. The Section 8 Housing Choice Voucher program is a federally funded initiative administered by local housing authorities. The program is designed to help low-income households secure housing by limiting the portion of income they are required to spend on rent. Under standard guidelines, voucher recipients typically pay approximately 30% of their household income toward rent. The federal subsidy covers the remaining balance, up to a government-determined fair market rent. However, in San Diego, fair market rents have increased substantially in recent years, placing pressure on the program's financial structure. According to the San Diego Housing Commission, average rental subsidies have increased by approximately 80% since 2020. This increase reflects rising market rents rather than program expansion. Federal funding allocations, however, have not increased at a comparable rate. As a result, the same level of funding now supports fewer households than it did in previous years. For the current fiscal year, the San Diego Housing Commission expects to receive approximately $274 million in federal housing assistance funding to administer housing choice vouchers on behalf of the city. Despite this allocation, the Commission projects a budget shortfall of $26.6 million for the voucher program. Housing officials attribute this deficit to years of rising rents combined with stagnant federal appropriations. Lisa Jones, President and Chief Executive Officer of the San Diego Housing Commission, has stated that the program is operating under increasingly restrictive financial conditions. When housing costs rise faster than funding levels, program administrators must either reduce the number of households served or modify participation requirements. Officials have indicated that removing existing participants from the program would result in severe housing instability and is not considered an acceptable option. Instead, the Housing Commission is evaluating changes that would require many voucher recipients to contribute a larger share of their income toward rent. Under proposed adjustments, some households could be required to pay up to 40% of their income toward housing costs. Housing officials acknowledge that such increases may present challenges for recipients, but state that this approach allows the program to continue serving as many households as possible. The effects of these funding limitations are illustrated by the experience of Simone LeBlanc, a San Diego resident and single mother. Ms. LeBlanc applied for housing assistance more than a decade ago after becoming disabled and losing stable housing. At the time of her application, she was informed that the expected wait time for assistance was approximately 7 years. 13 years later, she remains on the wait list. Ms. LeBlanc has been diagnosed with de Quervain's tenosynovitis, a chronic condition affecting the hands and wrists. Despite undergoing multiple surgeries, she continues to experience significant pain and limited mobility. She is the primary caregiver for her children, one of whom has multiple chronic health conditions, including lupus and epilepsy. Due to her disability and caregiving responsibilities, maintaining full-time employment has not been possible. Ms. LeBlanc reports contacting housing authorities annually to inquire about her application status and whether priority is given to applicants with disabilities or dependent children. She has not yet received assistance. Her situation reflects broader challenges faced by applicants navigating long wait lists amid declining program capacity. Housing officials confirm that extended wait times are increasingly common, not only in San Diego but nationwide. Demand for housing assistance continues to exceed available funding. As of now, the Section 8 waitlist in San Diego remains closed due to insufficient resources to support additional households. Federal policy decisions have also contributed to current conditions. Earlier this year, federal authorities announced the early termination of a COVID-era emergency housing voucher program scheduled to end 5 years ahead of its original timeline. Funding for that program is expected to be exhausted in the coming year. Housing officials report that many recipients of emergency vouchers are elderly, disabled, or both, and must now be transitioned into other housing assistance programs or face increased housing insecurity. The transition process places additional strain on an already constrained system. Ryan Klumpner, Vice Chair of the San Diego Housing Commission, stated that federal housing funding has not kept pace with rising housing costs for several years. Following the COVID-19 pandemic, rents increased significantly across the private housing market, including units occupied by voucher recipients. As rental prices rose, subsidy requirements expanded, increasing pressure on fixed funding levels. To address these challenges, the Housing Commission has initiated internal reviews and public workshops to evaluate program modifications. Emergency meetings are being held with resident service providers to assess impacts on essential needs, including food access, medical care, child care, and housing stability. Officials note that housing insecurity often compounds other forms of economic vulnerability. The Commission has indicated plans to provide hardship exemptions for certain households and to offer workforce development and job training resources where appropriate. However, officials emphasize that increased earnings may not be feasible for all participants, particularly those who are elderly, disabled, or full-time caregivers. According to Housing Commission estimates, closing the projected funding gap entirely would require removing vouchers from approximately 1,700 households, affecting an estimated 6,000 individuals. Commission leadership has stated that removing households from assistance is not considered a viable or ethical option. Instead, financial adjustments are being distributed across the program to maintain overall participation levels. Local officials caution that the outlook for affordable housing assistance remains uncertain. Without changes to federal funding levels or broader interventions addressing housing affordability, assistance programs may continue to serve fewer households over time. San Diego's experience reflects broader statewide and national trends. Rising housing costs, limited housing supply, and constrained public funding have placed sustained pressure on assistance programs originally designed for a different economic environment. While California continues to show economic growth in several sectors, housing affordability remains a persistent challenge for many residents. For households relying on housing assistance, access to stable housing increasingly depends on programs operating under financial strain. This report does not assess political responsibility or policy outcomes. It documents current conditions affecting housing assistance programs and the individuals impacted by funding limitations. The closure of the Section 8 waitlist represents a significant development for San Diego residents seeking housing support. For those currently receiving assistance, changes may result in higher personal housing costs. For those waiting, the timeline for relief remains uncertain.